The shift from bulk billing to private billing is definitely a challenge. And look, the key thing about this is that what we have to do is you have to train the patients going from it's free and I don't have to put my hand in my pocket to I have to put my hand in my pocket. So my best advice in relation to that is to, when you do increase, if you want to go to private billing, have a small out-of-pocket charge, $5, $10, something that's like a bit of a no-brainer from the patient's perspective. And once you've got the patients trained into obviously paying a little bit, then it's easy then to make it $15 or $20 and grow it over time. The other thing you need to be mindful about is you really need to support your staff. So make sure that when if you do make that change, the key thing is it's going to be the front desk that's going to take the brunt of the patient. So role playing, what would the patient say? What would we say as they reply? So once you successfully implement that, I would then do something for the staff and take them out for dinner or take them on movie night. Just do something as a thank you, because as I said, for a period of time, and it could be weeks, months, depending, and definitely probably is more like months. People will say, well, last time I was here, it was free and now it's not. But the key thing to remember is, look, there will be patients who will want to go and find another bulk billing provider. That's fine if they don't value your services. But if you deliver a good clinical service, most patients will be happy to pay something for it. One thing that maybe doctors don't realise is the benefit, particularly once you've learned how to do biopsies, how to incorporate that within their practice. If you set up your practice correctly, you can organise to do a skin check on a patient, and then if you then find something that's suspicious or the patient's obviously concerned about, you can very quickly and easily do a biopsy in your rooms at the same time, just have the insulin needles and the punch and shave devices there. And now you've got the ability to charge a 23 and a 30071 in that same consultation period. But what we have to remember, at some point the consultation stopped and the biopsy started. So you can't sort of have a 15-minute skin check and then a 7-minute biopsy and charge that as a 36. You don't add the time together of the entire process. There's the skin check bit and then there's the biopsy bit. But the benefit to you and your practice is you're going to substantially increase your revenue and your income by learning these skills.